Welcome, everyone. Thank you so much for joining us from your corner of the world. We're staying social, we're staying connected. We just have to be more creative about how we do it. My name is Andrea. I'm from PMD Alliance, the Parkinson Movement Disorder Alliance, and we're so excited to bring you this online program. Very excited. So we always like to have a subject matter expert, in this case, Dr. Serpa, and then a movement disorder expert, in this case, Dr. Subramanian. So you might have joined some other programs with her. She's actually the director of the Parkinson Center of the VA in West Los Angeles, and also practices at UC, or sees some patients at UCLA. And we're just so thankful that in these crazy times of shuffling schedules and healthcare workers at a premium, you both are taking time out of your schedule to help us out here in internet land connect. So I'll turn it over to you, Dr. Subramanian, and I'll let you introduce Dr. Serpa.
Okay, great. Thank you. Can everyone hear me? Hi, everyone. It's always fun to see all these faces. So we're doing a series of these because I think many of us as doctors, as I told you on Wednesday, have been missing seeing our patients and trying to give you a way to empower yourselves and us a way to empower you and just give back to the universe right now, which is feeling energetically a little off. So we continue to urge you, and I think even more and more, we're seeing warnings and advice to stay home as much as we can. In California, basically the mayor here in Los Angeles and our governor has been increasingly vigilant about trying to keep people in their homes and pretty much just having elective things be indoors and not outdoors. So again, we're urging people to stay out of doctors' offices as best as they can, stay away from the hospital as best as they can, follow the CDC advice. I think it's still okay to go for walks outside, be in nature, but be socially distanced from people. That's still the recommendation. And we're trying to convert all of our visits to video visits or telephone visits. And so that's, the increasing sort of advice. And I know that causes stress for a lot of us who've been used to connecting with each other. So I thought I would have in this series of virtual support group meetings, some of my favorite people in the world to speak about how we can help ourselves in these stressful times and keep from getting too anxious, keep from getting too depressed, keep from getting too apathetic. And so I wanted to introduce Greg Serpa, who is my mindfulness teacher. A lot of you know that I've had an interest in yoga and done a lot of mindfulness training at the VA. Largely was where I was able to do this. And Greg was my teacher there, and he is a psychologist who is very gifted in treating many of our sickest patients, sickest veterans with post-traumatic stress disorder, depression, complex patients. And he's brought mindfulness-based stress reduction and his own meditation practice to many, not only patients, but healthcare providers. And so I was able to learn some things from him and have thanking the universe that I was able to do that, because it's really served me well, I think, in times of stress, and that includes now. So wanted to open it up with having him guide us through hopefully a meditation of sorts, a grounding meditation, I think is what we decided. And then we'll open it up to having him talk a little bit about stress management techniques and some other things. And then we'll figure out, if there's questions, we'll take some, and then we'll end with the meditation. So I wanted to really have us be able to practice a little bit. And maybe also, John, you can give us some, or Greg, you can give us some, it's a little confusing because Greg's name is John Greg Serpa, but he goes by Greg. So maybe you can also give us any online ideas, and they can share them from the PMD Alliance page and even post them in this chat room so that our patients can possibly do some things while they're feeling a little distance and isolated at home from the comfort of their own computers. And if there's even non-online things that might be available through other mechanisms, or a book or something that we can even allow people who don't have access through the computer to access, I think it would be great, because I think we're realizing in this digital age that some of our patients and friends out there aren't really able to connect that well through digital mechanisms, or don't have the luxury of having a computer or internet access. And so if there's other things that are accessible to people, I really want to also offer those as well. And we continue to take suggestions and hope that you guys can help provide us with an idea for content. I'm hoping to continue to invite speakers, and depending on how long we're all homebound, we'll try to figure out what kind of offerings to give you.
Great. Thank you. I just wanted to do a little sound check. Can folks hear me?
Yeah.
Great, fantastic. It is a delight to be here with all of you. And I am a colleague of Dr. Subramanian, who both at the VA and at UCLA, where we both have academic jobs. I thought we'd just start with a little grounding practice. This will be something that maybe, let's just say 3 or 4 minutes, just to help us arrive a little bit. Usually, even though I'm now doing a lot of online stuff, there's always a bit of work and striving just to get the technology going. And even at the beginning here, while Indu was talking, I realized that my window was open and the neighbor kids are all screaming outside because they're all home. And I just thought, oh gosh, I have to close the window. So there's always a bit of discombobulation just as we get started. So I invite you here just to think about your body posture. And if you can have both of your feet flat on the ground, if that works for you, you want your body to have a sense of being supported and yet at ease in the chair. And if it feels okay, inviting you to gently close your eyes. That's not a requirement. If you want to have a soft gaze down towards the floor, or even look at the computer screen or your cell phone screen, that's fine too. And bringing your awareness right here into this moment, into your own body. Having a sense of your feet on the floor, if that's where they are. Perhaps noticing that sense of connectedness with the floor. And shifting to notice the parts of your body that are in contact with the chair. Or however you're sitting right now. Maybe noticing the weight of your buttocks in the chair, the backs of the thighs, maybe your back, maybe your elbow on the arm of the chair. And the invitation here is simply to let the chair do the work to support you and to hold you. Any sense of striving or effort or work it took to log on or to figure things out, just inviting you to let that go in this moment. And taking your awareness into your hands. Can you feel your hands right now? Can you sense that space between your fingers? Noticing the temperature of your hands. And then finally, in this shorter practice, just to get us going, inviting you to pay attention to your breath. As you breathe in, can you sense or imagine the air going all the way down into your feet on the inhale? And then coming all the way out of the body on the exhale. Letting the breath be easy if that's available to you. Giving yourself just a few more breaths to arrive in this moment all together, using technology to create community and connection. And in just a moment, I'll ring a bell to signal the end of our practice. And gently opening your eyes, blinking them open. And just inviting you to check in with what it's like to be in your body today and creating a bit of space for your experience to be just as it is. So welcome, everyone. I'm so happy to be here. What times we are going through in our communities, in the world, all this uncertainty, and sometimes all that uncertainty kind of gets into our body too, and takes up space there. So I'm very happy to be here and share practice with you and a brief talk today. So Indu, should I just talk about mindfulness? So is that how we're going to start?
Yeah, why don't we talk a little bit about mindfulness, because we have a series called Wholistic that happens outside of this time frame, and I was hoping to invite you anyway to talk a little bit about that and its benefits maybe on the body and the mind, maybe just snippets of just if there's research, just mentioning if that there are some studies or whatever, but largely just putting it in the context of what you think can help from a Parkinson's patient perspective, and just even in general for many of us who are healthcare providers or caregivers or people in the universe. So
right on. Excellent.
Yeah.
So I just want to start basically with what mindfulness is, because I think folks are actually a little confused. It is everywhere. When we used to go to supermarkets, you would see it on magazines at the supermarket checkout area with on the cover of magazines, and the special mindfulness edition and all of that. So it's ubiquitous and it's everywhere, but what is it exactly? So the definition I like to use is that mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So that's a lot. And what does that reduce to? So maybe it means paying attention, and it has that attentional component that we're focusing our attention is one part of it. The other part is how we pay attention. So, I primarily teach mindfulness to veterans, and this sometimes can be kind of a tricky thing. When I say what we're doing is we're paying attention with the qualities of kindness and curiosity and openness. And inevitably, I will have a vet, maybe a younger vet who's just back from Afghanistan, say, oh yeah, like nice, you want us to be fake nice, as if fake nice or being like kind is for suckers, or it's for marks. And it is something that folks with street smarts wouldn't dare admit as an aspiration. And actually, I'm not talking about fake kindness or being phony or anything like that. What I'm talking about is your relationship to your own body and to your own mind and to your own life. And this is actually a big deal. So sometimes I do like the wallet test, and I'll just imagine we'll do that with you. Let's say if you keep your wallet in your back pocket and or your billfold in your purse or an expensive pair of sunglasses or car keys or anything like that, and you reach into your wallet or your purse or wherever, and that item isn't there, and you run all over the house and it's not there, and you like look in the clothes you were wearing and it's not there, and you think, oh, now what have I done? And what does that internal monologue sound like? How do we berate ourselves? And that snide internal monologue that's always present, that is barking at us that we're not good enough, or our bodies aren't working the way we want, or the movement is causing us to be uncomfortable in public, or any of these things. And that internal monologue that is, sometimes it can be pretty nasty. The invitation, though, is to realize that all of that, the self-judgment, the criticism, the contempt, the whatever, these are human emotions that are available to all of us. And everyone on this line has had those things. We've all lost things. We've all had disappointments about our bodies. We've all struggled. So having that doesn't mean we're an idiot or a stupid loser or anything that bounces around like that inside our heads. It is, this radical idea I offer up is that it just makes us human, living a human life in a human body with the limitations that means. And this is that second part of mindfulness. Can we come up to that and hold that with a little bit of kindness, with a little bit of grace, with a little bit of ease? Why is that important? One of the things I study in my neuroimaging laboratory at UCLA with colleagues is meditation and brain and microbiome interactions. And this is actually pretty important. This constant self-criticism and judgment that many of us go through is acting as an anchor on our mood and is downregulating our immune function and leads to this chronic dissatisfaction, right? This is actually a pretty important thing. There's a lot that we can't control. Right now, I'm working from home. We can't control certain movements, chronic illnesses, life events, but how we respond to what life serves us is something that we do have some control over. And this actually has a big impact. One of the specific things I study is neuroplasticity, or how the brain changes over time and can be altered by some of the practices that we do. And we know that a regular meditation practice in just 8 weeks does change the brain in ways that we can measure in super important ways. And what kind of ways? In our perception of pain, for example. And that's something that I'm academically very interested in. How does our body respond to pain signals, and what we can do to help us tolerate these things a little bit better. So that is kind of what is mindfulness and why it's important. I think a couple of the things that I wanted to just say, the product, the benefit, the fruits of having a regular mindfulness practice can have three, there's so much research, it's hard to encapsulate it, but I think it's easy for me to say, to put it into three buckets. It's easier for my head to hold on to it a little bit. And the first bucket is mood symptoms. So stress related to illness and depression and anxiety and things like that, a mindfulness practice can absolutely be helpful for. So that's the first bucket. The second bucket is kind of physiological markers in the body. How we might look at stress markers and certain blood markers to see how our body is operating, immunological markers and things like that. And we know that a regular mindfulness practice really boosts these markers with less stress and an immune system boost. And the third bucket, the way I kind of think of things, is the brain changes and the neuroplasticity that I already discussed. So it is well worth doing, but it is kind of actually hard. People sometimes very often get started and don't continue. And I think part of the reason is people have this mistaken notion that mindfulness is about relaxation, and it's not. And even professionals in my line of work sometimes think it's about relaxation, and they're deeply mistaken. So my dad is in the final month or two of his cancer journey. And, my own practice, I'll tell you, it is not about like relaxing. It's about how I deal with the struggles of, my dad's illness and the progression of his cancer, and how that impacts the family, and that I can hold that not with this sense of like panic or dread or having to run for a bottle of wine, but that I can hold that with some kindness, because that experience connects all of us. We all go through things like this. It actually makes us human, and we can be open-hearted about it and create space for the full experience of our lives, just as we are. And mindfulness helps us do that, which is very different than saying, oh yeah, it's just about relaxation. And I think that caveat is super important, because then people think, oh, I'm sitting here and I'm paying attention to my breath, or I'm doing a body scan and I'm just annoyed and irritated and my body has some involuntary movements or whatever, and it's not working, I don't like it. I mean, if you're paying attention and you're noticing, this is what annoyance feels like. It just feels like this. And you meet it with a little bit of kindness, you're doing it just right. It is not about being all blissed out and feeling a sense of ease. Sometimes that happens, but a lot of times, our leg itches and we're annoyed and bored and we want it to be over, and we're still doing it just right. And that's just how it is. So that is kind of what mindfulness is, a little bit of the research, and why I think it's important to realize that it's not about relaxation. We can talk maybe at the end about useful tips for how to get started and some of the great online resources that are available. And maybe we can provide some and they can send them out by email. Some of the great free resources that are available to folks for guided meditations, and that's available. I will say specifically, there are some clinical trials and some early suggestions that specifically with Parkinson's, that mindfulness can be helpful for coping, for mood, and for the relationship that we cultivate for the having a relationship with one's own body. And sometimes a sense of betrayal or distress about being in a body that whose capacity is changing can be really hard. and easing that, I think, can be helpful. There are some limited reports that it can help with involuntary movement, but I don't think that we have enough information yet specifically with folks with Parkinson's and mindfulness. It's a growing field in research. So, Indu, I'm thinking, do we start a practice and then have questions, or do you have any questions?
Yeah, I have some questions. So I think I think that my sense of how we can use mindfulness to help our patients in general with Parkinson's. A lot of our patients have depression, have anxiety. Like 40% of our patients with Parkinson's actually have, these are things that are very common. And I think anxiety can be helped as well as depression. There's a sense that more stress can affect progression of disease and can lead to even cognitive changes sometimes. And some of our patients can actually get mood related cognitive issues, but there's also sometimes separate cognitive issues. And so lack of focus, memory, things like that, I think can also be helped in some situations with mindfulness. And so even though we don't have a lot of data in Parkinson's disease specifically, many of the things that are in the Parkinson's universe, like mood, cognition, sleep dysfunction is another one. Many of our patients have insomnia, disrupted sleep cycles, and I think that mindfulness can drizzle into these things as well. Additionally, you know, in my day-to-day work, I take care of not just patients, but their caregivers as well. And I think we know that caregivers are under stress and that stress can affect their wellness and health, and actually is a prognosis changing sort of, and I think modifiable possibly problem. And so I think mindfulness can help with that as well. And in my own life, just so people know, it is very tough, I think, to find time to do a practice, and even 5 minutes, if it's a way to start, and then, you know, working upwards is helpful. And I know that when I was in your classes, it was homework, you know, but it was in the long run, I think, very helpful. And there are not just mindfulness practices that are necessarily sitting, but sometimes, you know, walking meditations, possibly even being in nature can have a mindfulness component. And just noticing sometimes these small things, I think, in my day-to-day interactions, as I'm running from room to room, seeing patients or staffing people, sometimes just taking a moment and stopping. And, you know, that exercise that you taught us about, you know, sort of the stop or whatever exercise, maybe you can describe that. But I think there's many, many little things that we can insert into our day. And I think now that we have a little bit more time sometimes with these sort of being at home and not being able to be outside and slowing down the pace of life a little bit, I think that perhaps we may have some more time to reflect on some of these practices. And I think that they can actually perhaps be a silver lining in all of the craziness that's happening right now. So I don't know if you can comment a little bit on that, but I'm trying to keep the positive vibes out there. And I'm definitely feeling like there are silver linings that I'm seeing.
So some of the things that, thank you for giving me some nice pitches to swing at. I appreciate that. Some of the things that you talked about made me want to introduce this idea of formal and informal practice.
Yeah.
So what we did at the beginning, you know, shutting our eyes and paying attention to the sensations in our bodies, what we might call a formal practice. We're doing nothing else. That's mindfulness. An informal practice are some of these other things that Dr. S is talking about. And that's also mindfulness. We're supposed to be washing our hands a lot more now. We can wash our hands mindfully. We can wash dishes mindfully. You can dress mindfully. You can pet the cat mindfully. And these are important practices too. So what we're developing, not to sound too much like a psychologist, I can't help myself, what we're developing is metacognition, right? We're developing awareness, thoughts about our thoughts. That's metacognition. This is actually pretty important. for anxiety and depression, that we're starting to notice the patterns and the habits of our minds and what our minds do. And if you are doing the dishes and your mind starts wandering to, oh gosh, what's my family going to do? And are they all okay? And it's like, wow, okay, that's wandering mind. Let me just feel the warm soapy water in my hands as I wash the dishes. Right? So that is a real mindfulness practice, even though it's informal and your eyes are open. And it helps you start noticing the habits of your own mind. And we all kind of ruminate a lot about all kinds of things. Some of us are thinking about the future a lot. I'm a crazy planner, and I will admit that that's me, that I'm in the future a lot, thinking what's next, what's next, what's next. And we're missing out our life right now. Always thinking about what's coming down the road. Some of us are rehashing past events, thinking, oh, how come this, and why didn't I say that, and whatever. So frequently we're rehashing and rehearsing, and we're not paying attention to right here in this moment. And that's a super important thing to do. Right here, just as we are, even if this moment isn't perfect. And that's kind of what's hard to sometimes get our head around. People will frequently say to me, I'm not comfortable in this moment. I don't want to be in my body in this moment. Why do I want to be in this moment? For any of those reasons. And this is a pretty important thing. This is the moment that we're living in right here. And we're not doing that discrepancy analyzer. We're really good at that. The way we imagine our life should be minus the way our life actually is equals how miserable our life is. And it's very easy to do that. But can we be with the fullness of our experience right here in this moment, just as we are? And that is super important. So my cat is coming to say hello. If you're hearing some meowing, that's not me, that's the cat who's like, why aren't you petting me? Sorry about that. And the other comment about some practices, I talked about washing the dishes mindfully. Another thing that you might want to do that you can do even with some limited mobility is what we call a sense and savor walk or movement, even if you're in a rollator or a chair or have a cane or anything, an assisted device that helps you move. If you, especially during this time, to go outside a little bit and just open up your senses to what catches your attention. And this is a great mindfulness practice with your eyes open. It may be bird song, it may be a fragrance, it may be your feet on gravel and the sound that it makes. But can you notice and savor? Can you bring something into your senses and savor? And savoring has two elements, of course. You have to notice it, and then you linger a bit with it to be with it, to enjoy it a little bit, right? It's like if you're eating your favorite meal, you don't want to just eat and swallow. You want to bring that sense of savoring. And can you do that with a little walk in nature? We're not talking about a 5-mile hike. We're talking maybe about 15 feet of just noticing a plant or the texture of a brick wall or the sound of nature or the sound of even traffic, and just noticing and being with that experience just as it is. That can be a great little break from being in the house during these times. So those things are super kind of important. And so I think the other thing we'll send you, if we can, Andrea, we can send out a couple of tips. I just wanted to, great. The other thing we can send out is a stop technique. And this is what to do if you're reacting. to anything, whether it's reacting with upset or wanting to yell at somebody or whatever. And the stop technique is something that we recommend. It's an acronym. The S stands for stop. The T stands for take a breath all the way in into your toes. The O is observe. Observe your experience, right? What's going on in my body? What's going on in my heart? What's happening? And the P is proceed. Proceed in a way that feels right to you. That feels like it's the right response, whatever that might be. And it's a way to move from reactivity to skillful responding, which is what we try to do with our mindfulness practice, is move from just reactivity to the world around us, which is a very reactive world right now, into responding with more wisdom and grace. And this idea with our practice is that wisdom and grace actually lies within us already. And if we just give ourselves a moment, we can react, we can find it without reacting quite so much. So Indu, I'm thinking I want to transition to a longer practice, and then maybe we can have a few questions after, if that's okay.
You want to do that? Or I was also going to just ask you about the concept of resilience in a time like this.
Oh, yeah.
For a second.
Sure.
I think that's very powerful.
Right.
And then we can maybe do the practice. I don't see a lot of questions here except for one on MBSR and an 8-week class and whether, and maybe we could talk about that with the resources at the end. But
Great.
Yeah, let's talk about resilience for a second.
Great. So resilience is a funny thing. It's very easy for us. We always have dichotomous thinking. Black and white, it's yes or no. And resilience actually doesn't fit into that model. We all have resilience. It is something that is within us, and it is a capacity that is along a continuum, and we can enhance. There are things we can do to enhance our resilience. Resilience being defined as our capacity to bounce back from adversity. And there's this relationship that when we are feeling depleted, that we are more reactive and we're less resilient. So there's always, now is a good time for all of us, providers, caregivers, folks with Parkinson's, everyone in our community, everyone, to work on our own resilience, because it will be tried, I think, in the weeks ahead with what's going on. And there are things that you can do to enhance your resilience. And part of that is stay connected. Here we are in this community, and it's such a beautiful thing. And I really appreciate being here with everyone. But connections is an important part of resilience. Checking in with yourself and letting yourself be fully human. And realizing, like, what is it that you need in this moment, which is sometimes a hard thing for us to nail down. Making sure that you're eating and sleeping well enhances resilience, and that you're taking good care of yourself. Thinking about your sleep. When we're sleep deprived, that makes us more vulnerable too. So all of these things can be helpful. A mindfulness practice, a little bit of movement, even some chair yoga, which we do a lot with our veteran population. We have a lot of veterans with, of course, prosthetic limbs, with movement disorders, with spinal cord injuries, and almost everybody can do some level of a chair yoga, even if it's just moving an arm a little bit, just to bring some awareness into the body. So all of these things can be helpful.
And even, I think the loving kindness sort of practices, I think, are very helpful as well, because I think one of the things that we've spent a lot of time doing as doctors and people who are caregivers and, allied health professional, physical therapists, is try to motivate our patients to get out and exercise and get their heart rate up and do all these things in groups. And now we're sort of saying, stay more, near home and indoors and not be in groups. And, I think that a lot of patients are beating themselves up a little bit and saying, I should be doing this for my Parkinson's disease because my doctor said so. And I'm now not doing that. And I can't even go in to see my doctor. And she's calling me on the phone and like, what's going to happen to my disease? And I think that sometimes just letting go a little bit, giving yourself some space, allowing yourself some, time to possibly heal and rest and reflect, I think is what we all need possibly right now. And maybe that's what the world is telling us. I don't know. It's hard to know, but again, it's all.
So this is a great segue. What I was doing, I always do the practices that I need right now.
Yeah.
So what I was going to do is I introduced our practice is talk about the difference between mindfulness and compassion. So these are related things. A lot of people think that the distinction of making them two separate things is splitting hairs, but a lot of mindfulness is what we call bare noting, that this moment is just like this without us trying to change it in any way. And that might be what we call one wing of the bird, but a bird can't fly too far with just one wing, and a bird needs two wings to take flight. The second wing of the practice that we're going to add, that we're going to do in here, is bringing in kindness and compassion. And this is how we kind of warm up our hearts. We can't force that to happen. We invite it in and we create the environment to see if this is the case, that we can enhance our sense of being connected, our sense of kindness and compassion towards ourselves and the world in this difficult time is a really important thing. So there are practices of just noticing this moment and practices that we try to warm it up. And this is what we're doing, what we're going to do today. So Dr. Subramanian mentioned loving kindness, and we're going to do a practice called compassionate breathing that I will ask you to do along with me. So maybe we'll say it'll be, I'll make this up, 6 or 7 minutes or 8 minutes. We'll see how it goes, just to give you a sense of how that is. And again, I invite you to settle into your posture, your seated posture. Maybe have both of your feet flat on the ground again. But of course, anything that helps you bring comfort into your body is fine, is just fine. And again, inviting you to close your eyes if that feels right. Bringing your awareness into the body that you're in right here in this moment, and whatever's happening for you. And if there's any sense of fatigue or ache or involuntary movement or whatever is going on for you in this moment, just inviting you to let it be. And just create a little space for things to be as they are. And inviting you now to shift your attention to your breath. And in particular, shifting your attention to the inhale portion of the breath cycle. Breathing in. Breathing in. And having a sense that the air that you're breathing in right now is nourishing your body. With each breath, as you breathe in, feeling a bit more at ease, if that's available to you. And now sensing or imagining on your next inhale, as you breathe in, it's not only air that you're pulling into your body, but kindness and compassion. All the people in your life that support you, almost as if the molecules of air that enter your body are also holding little bits of kindness. And as you breathe in, you're pulling that all into your body and letting it be just for you. You might imagine from all the people that are on this call here, as you breathe in, taking in compassion from this entire community. And especially if you're a caregiver, giving yourself permission to take in kindness, especially for you. You too are worthy of compassion and having ease in your body. And if it feels right to you, shifting your attention to the exhale portion of your breath. As you breathe out, also letting go. Breathing out and letting go. And now imagining that as you exhale, with each exhale, you are sending out into the world some kindness and compassion that lives inside your own body. And as you exhale, you're sending it out to everyone else here on this call. And as you exhale, you're sending out kindness to everyone that's been asked to stay home that might be afraid right now. With each exhale, sending out compassion and kindness. And now inviting you to shift your attention to focus on the inhale and the exhale. The taking in on the inhale and the sending out on the exhale. Taking in kindness and compassion that's just for you on the inhale. And sending it out to everyone else here on the exhale. With each breath, feeling a bit more at ease, a bit more balanced. Taking in what you need. And on an exhale, if you have the capacity and if it feels right to you, inviting you to send it out to everyone in your community that might be going through a hard time right now. And in a few moments, we'll be ringing the bell to signal the end of this practice. Just a few more moments here, taking in kindness for yourself, a sense of wholeness, and a sense of ease, knowing that this is always available to you. And may the light rain of compassion shine on all beings everywhere without exception. And with the sound of the bell diminishing, welcoming this new moment and inviting you to check in with your experience, understanding or being curious and interested in how you're feeling in your body. I'm going to get up just as we finish and shut the door. And come back. I think my kid, who's with his 4th grade class, starting to sing. So if you heard that in the background, sending all those 4th graders trying to have some kind of educational experience all at home with their parents, sending them some compassion too, and their parents. Great. So that was compassionate breathing practice. And however it was for you, is great, is fine. Sometimes we feel those feelings and they come up and they're right here close to us. And sometimes they're a little elusive, and that's okay. However it was for you, it's okay. And that's it. We got a couple of messages there. Thanks, Andrea. I appreciate that. This is certainly a time that we could use some compassion, all of us. It's a hard time for the world, but we can hold center and be resilient and stay connected to all those folks around us.
That was beautiful. I mean, every time you teach, it's just kind of crazy. Wow, you're a gifted teacher, Greg. Thank
you, my friend Indu.
So, I mean, I think the compassion also goes out to all our frontline healthcare workers too that are in the hospital right now, trying to take care of patients around the world and risking their lives. And so whatever we can do to help, spread some peace and joy and good wishes and positivity, I think we'll try to continue to do through this. It's kind of my way of giving something to myself and to everyone else to keep sort of going and keep happy and feeling like that there is some way to connect with all of you. And thank you for sharing that about your father. And I'm sorry that that's the case, and the best of wishes. So I think that we continue to try to find ways in our home, in our solitude in some ways, to connect. And I think that, you know, echoing the sort of hopes of, you know, trying to reach out if for those people who are our neighbors or loved ones who may not even have technology to pick up the phone, really important to try to reach out to those people. And I think sometimes just seeing those who are less fortunate than even ourselves sometimes, you know, can give us some new energy to try to help and continue to spread goodwill in these times. And again, you know, the silver linings, I think for me, I've been trying to appreciate, I have my children at home as well, and they're driving me completely crazy, but, you know, taking a minute or two to enjoy each one in their own, you know, annoying ways is beautiful. I think for the first time I've been looking at my garden and looking at even a rose out of a window. I mean, I think depending on how active and our environments, like you said, the brick wall, the coolness perhaps of you know, the floor below us, the wind, the breeze, the sun, and our breath, which is always for me so anchoring and so beautiful. And no matter where I am, I will always have that. And I think it's a really beautiful thing. So I'm so glad that you use the breath. And I love the, you know, the sort of taking in and giving out, and the balance at the end is just really lovely, really lovely. So I hope to.
I will be sure to send along that, Andrea, and you can pass around some links to some of those exact meditations and some other things and some of those little practices. So I'll be sure to pass those along before the end of the day, and hopefully you can get them all out soon.
Yeah, so I think there's a lot of just questions about, can this be viewed again? Absolutely. We're hoping to give content. And we talked even about, you know, and Greg, you taught me about this, you know, somebody wrote, be grateful you have children to complain about. Absolutely. Every day. But you know, finding ways to access people who are even not able to access this is something that's been important. So we're thinking of even possibly taking these videos and putting them on a DVD or something to be able to pass out to people perhaps who don't have computer access or internet access to be able to watch, or if you have any other ideas, because I know that you treat some amazing people at the VA, and every day you come to work and find ways to find solutions to help our most vulnerable populations, our homeless, our post-traumatic stress disorder, our, you know, sickest patients and the sickest, you know, folks out there, and you find ways to bring this to them. And so we want to try to use your, you know, past experiences and ideas, and any other mindfulness teachers that are out there. We're happy to have them on our, you know, this support group, the wHolistic support group. Jack Cornfield, huge, amazing teacher, Trudy Goodman, Sharon Salzberg. John Kevitson, I know, is having a free event, guided meditation coming up. So much out there. So, you know, we'll try to see if we can get some resources, and Insight LA, which is, you know, a group that you belong to as well. Greg has been amazing for me, has had drop-in meditations, and now has had a lot of online resources. And so I think we continue to try to find ways to connect. And hopefully this was a taste for those of you guys who are out there in support group world, patients, caregivers, healthcare providers. I think some of you allied health professionals that maybe haven't tried mindfulness, to maybe give it a try and possibly sign up for something in the future, such as an 8-week mindfulness-based stress reduction class like I took with you, Greg. And so, yeah, let's keep the sort of good vibes going for sure. Do you have anything to close, Greg? And
just,
Andrea will then.
You know, we're all together here. We are connected, even though we're not in person. And in times like this, having that clarity and community and compassion is a very important thing. And that can sustain all of us during tough times. So thank you so much for your invitation and letting me be here today. And I wish you all well.
Thanks.
Thank you so much. Thank you, Dr. Serpa. Thank you, Dr. Subramanian. This was great. From that first grounding practice, and then just, all that great information, and then to build to that powerful close. I think a lot of us needed it. So appreciative for both of you sharing your time and your expertise. Thank you, everyone out there. Maybe those who this is new to you, new to Zoom, new to mindfulness, trying something new, tackling technology, bravo. Bravo to everyone. Like both of the doctors mentioned, we are compiling those resources, and I will both have it on our the webpage that has this entire series. So I will paste that again in the chat, so you can find it. The recording from the one that we did on Wednesday is already up, and also the resources that Julie, the PT, shared is up there. And we'll paste this recording there as well, and you can see what else we have planned in this series. So, and then the other thing that Sarah just shared with us, we built a survey. We've been asking you, what do you want to hear about? What do you want to know? Is it coronavirus especially induced topics? Is it, you still have my same old Parkinson symptoms, or, a combination? So I also put in the chat a link to a survey that we made, so you can, communicate to us what you want to learn about. And I'll have that on that same coronavirus series page, or somewhere on the website, because I know not everyone knows how to use the chat function. So let's see. The next one of this special series is going to be Monday the 23rd, again at noon Pacific, 3 p.m. Eastern. So we're going to have another movement disorder specialist from Rush University in Chicago, Dr. Jory Fleischer. And she's been doing some interesting work with palliative care and